and welcome to another edition of On the Town. I'm Don Mackey. I have tonight as my guests two members of the Town of East Long Meadow Board of Health, Dr. Sarah Perez McAdoo, Chairman, and Karen Robitaille. Kevin Hinchy, Dr. Hinchy is unable to be here tonight, but welcome to both of you.
Thank you.
Thank you very much.
So we're going to start. I just want to tell folks that this is somewhat preliminary to a meeting on Thursday. We're taping this on Monday night. And this Thursday, April 27th, you will be participating in a public forum at Birchland Park Middle School, really around the issue of the proposed ban on the sale of recreational marijuana within the town of East Long Meadow. That's a question that is going to be put on the town election ballot for this June. And residents are encouraged to attend the public forum on Thursday and hear your presentation and participate in that conversation. But before we get into that, you are new members of the Board of Health. The Board of Health as it exists now in the town of East Long Meadow is different with the charter and the change in form of government. And you are both, as is Dr. Hinchy, medical professionals. So do you want to talk a little bit about how you see your role and what interested you in stepping up to be a sort of really health-focused Board of Health, professional Board of Health? Either whoever wants to start.
Sure. Well, traditionally in the town, the Board of Selectmen has served as the Board of Health for the town under our older form of town government. And with the charter change and the expansion into a town council, that created an actual separate Board of Health. And that's where we came in, and I think that I was very, very interested in serving on the Board of Health. I actually know our Director of Public Health from previous work. I work for the city of Northampton, and right away I was interested in serving my town in this capacity. I've always been interested. I work in public health. I'm very interested in trying to help make our community a healthier place to be, or keep it actually a healthy place to be, because I do think it's a very healthy community overall. And yeah, I think that's about the gist of it. So it's very exciting to have a real Board of Health separate from the town council. And in Massachusetts, what's kind of unique about boards of health is that we actually are empowered by Massachusetts state law. So it's really the only town or city board that actually has the power of law behind it. And the things that we do are based in regulations.
State statutes.
Yes.
And I do agree with Karen in terms of sort of what kind of brings you to this role. I think it's a great role where we can really contribute to improving the health of the community, as Karen was saying. You know, being able to continue to look at ways that people can have a healthy lifestyle and address any challenges that we may have, but also, you know, looking forward to what could we do to enhance the health of the community. And I think for me, living here has really been a tremendous benefit for me and my family. And this was a really good way to give back. And similar to Karen, my background as a medical profession sort of shifted more into the public policy, really understanding that when you look at sort of the rules and regulations that form in communities, that they really have an impact on your health. And you know, what would that look like at our town level was very interesting to me. And you know, it's been a pleasure just to begin the first few months of serving in that role. It's been quite interesting. I've learned a lot, and I'm really happy to work with a wonderful team in terms of the colleagues that are on the board, as well with the town council and the town manager and our exceptional really director of the health department, who's a wonderful champion for our community. So it's been wonderful to begin.
What are some of the other things that you've been engaged in other than this issue, the marijuana issue, really since you've started, that you know, that you think you've had an impact.
Right. And I think
Well-
especially for us at the very beginning, I mean, being new, we really had to put this together, the board together. So we really started from scratch, and working with our health director, we were able to identify sort of where are our gaps and challenges and where are some of our assets. And I think just making sure that we have the infrastructure,
Right.
that our health department has the resources and the staff that it needs to be able to carry out the responsibilities was critically important. So
Yep.
starting at the very beginning. And as Karen mentioned, we have the responsibility of really making sure that we fulfill the obligations from, the Massachusetts state laws that, that are around housing and health codes, sanitary codes, environmental codes. So there's a wide range of responsibilities we had, and we had to make sure that we at least had the resources to make that happen. So that was the beginning, I think.
And even more concretely, we had to create a mission for the Board of Health and a goals document for us moving forward, kind of a strategic plan for what we wanted to work on first and second and third. That's all needs to be based on data, so we had to look at all the data that was available in regards to the health of the community and really do a good assessment of the community, right down to helping our director really kind of get a grasp of all the different rules and regs that we need to be adhering to, what food establishments need to be inspected, and when was the last time they were, and when are they due again, and kind of she created this nice spreadsheet, so now we kind of all know where we're starting from,
Right.
and we sort of have a map moving forward. And even things as simple as updating the website, developing a Facebook and a Twitter presence for our board. Very, very helpful when you're trying to communicate things to your community.
So give me three things that I sort of specific responsibilities. So one of the things you mentioned was restaurants. So certainly in terms of sort of administering the policies of the board, the health director does food establishment inspections, housing code violations. So what are, I sort of probably named the top two, but any others that sort of come to mind that you as sort of the policymakers see as, these are things that people really don't think about on a day-to-day basis as the town having a sort of health responsibility for, that are really critically important, that people just sort of take it for granted or overlook it or whatever. Do you have any of those?
Well, those are definitely two of the bigger ones. But also disease surveillance. So a lot of people don't know that there is a statewide system that tracks communicable disease, and that's part of our job, is to watch that and kind of keep a pulse on what's going on in the town and step in and act if necessary. Amy this fall did a flu clinic for the staff, which was the
successful,
first
yeah,
time
yeah.
she's been able to do, the town has been able to provide something like that for its staff and possibly the residents in the future. Very important to offer that, especially for your older residents. So it's things like that. It's preventative things, and it's also interventions as well.
Health promotion.
It's both things.
The other thing I just maybe touch on for residents with the change in the form of government, actually the health department structure as a department changed considerably. So you have what were formerly kind of separate entities now under the health department jurisdiction. You want to talk about that a little bit?
Correct. Well, now the health department has a director.
Yep.
And she's got some clerical help, which is enormous. I mean, there is a lot of paper that crosses the desk, so that needs to be managed. So we've got that in place. The health department's also responsible for the Medical Reserve Corps, which is something else that a lot of people don't know about. If there is an emergency in your town, flashback to the tornado and the shelter and the ice storm, the shelters that need to be set up. So she has help with that. She has some help with public health nursing, and that's where that disease surveillance comes in. That
Right.
person is responsible for checking that system and keeping Amy apprised of what's going on. So now there's actually this nice structure to support the health of the town.
So, well, I guess we'll go to Thursday's event and the sort of immediate issue at hand with the proposed ban. You were able to get signatures from the
Yes.
community to put a question on the ballot. It's been in several other communities across the Commonwealth. To ban the sale of recreational marijuana only, retail sale
Retail,
Yes.
of recreational marijuana in the town of East Long Meadow.
correct.
Talk a little bit, I guess,
Yeah.
Dr. McAdoo, about Thursday's event and what you hope to accomplish there.
Absolutely. I think one of the things that you could point out when you mentioned sort of what our responsibilities is looking at public policy. And I think this was one law that we carefully looked at and said, how does this law have an impact on the residents of our town? And we began to see that really looking at the impact it has on youth development, especially brain development as well as children. And given the fact that we have a large, population of young people under the age of 18, we really realized that this law has the ability to have a negative impact on their health. And I think that for us, that became critically important to bring this issue to the forefront of our community. So this Thursday, we'll have an opportunity to have several professionals, the Board of Health. We're going to also have the Chief of Police, as also the school department as well, and others be able to provide some more information to the community about this particular law and the health implications it has, as well as also having an opportunity for residents to ask questions and really sort of delve into the issue, because I think that there's a lot of maybe misinformation or maybe not enough information that people don't have that's going to help them be able to make a decision. I think for us, the most critical piece of it had a lot to do with the edibles. That's one part that has that highest level of sales for them in this particular industry, but it could have a significant negative health impact on young people. So for us, bringing that to the forefront was critically important, for parents and community residents. And it also helps us to really start beginning to shape, well, what do we want for our town?
Right.
What kind of environment do we want to create so that families and children and youth and all our residents can really thrive? So seeing that there's still this health hazard with this particular law, I think it was important for us to really begin to address that. And right now, given the way that the law is written, it's not very clear in many ways, and it also has limited our ability to regulate it in other ways, especially the edibles. So taking this step to put the question on the ballot puts it in the hands of also the community members to decide whether we should ban it. And our professional recommendation is that we should move forward with that and allow residents to be able to vote.
Yeah. And I think I grew up in East Long Meadow. I've lived here my whole life. And if you think about this town, there are a lot of things about it that really contribute to people's sense of health and well-being, whatever that is for any given individual, knowing that there's variance in that. But the town is walkable. There's a lot of sidewalks. The town center is bustling. There's a great library. There's lots of things that are within walking distance. We have a nice park. We have 2 major grocery stores, so we don't live in a food desert where you don't have access to fresh fruit and vegetables. We've limited fast food. There are no drive-throughs. There are lots and lots of things for young people to do, ways for them to get involved, lots of athletics, lots of things that actually allow people to make, in public health, we say, make the healthy choice the easy choice.
Right.
And so we just want to continue to contribute to that, and conversely make maybe a more unhealthy choice a bit more difficult. And as Sarah said, especially in regards to the edibles, there's no way to regulate them. There's no limits on potency. They're quite dangerous to young people, and they're a real concern for us.
Let me ask you a little bit, just a comment on the law, the way it came about in Massachusetts, versus maybe compare it to the law in Colorado.
The interesting thing about Colorado's was a bit different than ours, where theirs is an opt-in. So what that means is that in order for a community to to have retail sales of recreational marijuana, they had to opt in. They had to vote to opt into that. So consequently, most communities in Colorado do not have retail sales of marijuana. It's very much so concentrated in a couple of larger cities. Our law is different. We are opt-out. That means that every community automatically will be open to businesses coming in and doing retail sales of recreational marijuana unless they vote to opt out. So it's set up a bit differently, and it was a voter referendum. The lawmakers didn't have any opportunity to do any work with it.
Right.
It went to vote as it was.
Right.
Right now, they are scrambling they had another hearing this afternoon. The last hearing, this was an added on hearing because they've heard so much, they had to keep adding on hearings. There's so much work for them to do on this law. There are so many gaps and so many places that really need to be shored up. It's unlikely that they're going to be able to get that work done before it actually it's in effect, but before medical establishments are able to convert automatically to retail establishments. And that's our other concern.
Yeah, and I think that's a key point, as Karen was mentioning, is that the state has to create a brand new regulatory system from seed
From
to
scratch.
sale, from scratch, for an industry that previously did
Right.
not exist. So I think there's going to be a steep learning curve, not just based on what we've learned from other states, but as Karen pointed out clearly that our state, is doing things slightly different. So I think it's going to be important that this is going to continue to evolve. But what we do know now really limits our ability as a board to be able to regulate, we think, the part that kids would have most access to. And that is very concerning. So, we looked at what do we have the ability to do now, and that's sort of the steps that we're taking to protect the health of young people. And also, as Karen pointed out, if this Cannabis Control Commission, as they're doing their work, if their regulations are not released by the time that they have their deadline, any medical marijuana, facility can automatically begin to sell retail sales without having that system, that regulatory system in place. So that's also concerning to us. Now, one of the things, just to make sure that people understand, is that the ban on the retail sale of recreational marijuana does not impact personal use of those that are 21 and over. So that doesn't affect that, and it does not affect the sale of medical marijuana either. That's separate. So that's important to understand.
Right.
But I think that one of the most amazing things about being involved in these discussions, and it's constantly changing, but it is fascinating that this whole industry has to be created from the ground up, this regulatory system. And that, I think, is probably going to be a challenge to be able to do that in a very short period of time. So I think our town has the ability to sort of step up, and, with all the professionals and all the leaders and community members, I think that we can do the right thing for our community. The only other comment I would make is I think our work is very engaging. In other words, we're not doing our work in isolation. This is one good example of it because we are creating this forum,
Right.
And it's a way for community members to be involved, in the public health work that we're all doing. And the other part is, our work is collaborative. So really working with other, town directors, leaders, and anyone else who wants to be involved is going to be critical to continue to promote all the good stuff that Karen mentioned about the town,
Right.
and any challenges that we see. And I think being proactive allows us to become that town that thrives in Western Massachusetts than just, sort of survive or just or just make it. And I'm only pointing out because I think that as we're looking at the data, we realize there's a community health assessment that was completed, and we're beginning to look at that closely, which really helps us to understand what are the priorities, the health priorities of the community. And this is just the beginning. So as we sort of use that as our guide between looking at our public health infrastructure and also looking at the town policies, that we make sure we address the things that people are concerned about, and making sure that we put in programs or policies that really will help our town thrive into the future.
I know it's our director's goal to have health at every table across the town, to have everyone really have in their mind to consider health when they're considering anything that is happening in town.
And I think right now, during this particular, I think, time in our lives, with still challenges in terms of finding jobs, and education is critical. I mean, there's three really key things that people really need, and one is education, health, and jobs. And health is affected by all those factors.
Right.
So I think that we don't look at health in isolation, like, this is just about your heart health, or
Right.
just about your diabetes, or we're really looking at health in a much more comprehensive way. How is this town structured so that a person can really live a healthy lifestyle, so that they can thrive at work, at home,
Right.
in school? And I think that if we get very close to that, I think we would have done a pretty good job. And I think we're on our path to begin to get there.
That sounds great. Well, thank you both very much for coming in, and we look forward to Thursday night. It's going to be an interesting conversation,
Yes.
and would love to have you back anytime you want to come.
Great.
Absolutely.
Thanks
Thank
for
you very
having
much.
us.
Yes.
That'll do it for this edition of On the Town. I'm Don Mackey. Thanks for watching.